Welcome back to Smart Life. I'm Kathy Buccio. It's that time again, Medicare Open Enrollment, where you can select a Medicare plan with the features that are best for you. Here to help us understand more about how people can find the plan that's right for them is Camille Harrison, Florida Blue's Executive Vice President of Medicare and the Chief Innovation Officer. Thanks so much for being with us, Camille. So let's get right into it. There seems to be a lot of confusion about the ABCs of Medicare. So can you briefly outline what Part A, Part B, C, and D are and how they work together?
Okay, so Part A covers things like inpatient hospital care, skilled nursing facilities, hospice, lab tests, surgery, and home health care. Usually there's no monthly premium for Part A, and there are deductibles, coinsurance, and out-of-pocket expenses to pay. For Part B, that covers certain doctor and other healthcare provider services and outpatient care. Also covers durable medical equipment, home health care, and some preventive services. It does have a monthly premium, and there's also a yearly deductible and coinsurance. So together, Part A and B are commonly referred to as Original Medicare. Part C, also known as Medicare Advantage plans, are offered by private insurance companies like Florida Blue Medicare. They include benefits of Original Medicare Parts A and B, plus more. Plans may include Part D, prescription drug coverage, dental, vision, and hearing coverage, extras like gym memberships, rides to the doctor, help around the house, and even support for caregivers.
So what should people consider before switching to a new plan?
It's all a personal choice, and you really have to think about the circumstances that you're in, right? What are your needs? What was the care that you had the prior year, and did that plan that you had, if you had one, meet your needs? So on a cost basis, both the monthly cost and the out-of-pocket cost when you are getting care or prescriptions, super important. From a coverage vantage point, think about your health and how it changed over the past year. Have you developed a health condition or started a new medication? What extra benefits are important to you? Do you care about dental, vision, or hearing? And then those extra perks like the gym memberships and rides to the doctor, if you need help around the house or even have support for your caregivers, those are things you might want to think about as you're looking at a plan. Then also convenience. Do your doctors, your dentists, and your local pharmacy accept the plan that you're considering?
So we've heard for the first time that Medicare can negotiate prices on 10 commonly used drugs. When will that be going to effect, and how is that program going to work?
The cost of prescription drugs is a complicated issue, and it's gotten a lot of focus lately, thank goodness. Americans pay higher prices for prescription drugs than any other country in the world. Prescription drug prices in the U.S. are more than 2.5 times as high as those in other similar nations, according to research by the Rand Corporation. These drugs were selected because they have been on the market for a number of years and do not have a generic or biosimilar product. These selected drugs accounted for $50.5 billion in total Part D gross covered prescription drug costs between June 22 and May 23. It has the potential to lower the cost for Part D prescription drugs and the potential to reduce the out-of-pocket costs for individuals who take these medications. Another important point is that over the next 4 years, Medicare will negotiate prices for up to 60 drugs covered by Medicare Part D and Part B, and up to an additional 20 drugs every year after that.
How can people get more information when it comes to Medicare?
Have a conversation with the doctor, right? A community resource, someone that you have a connection with. Ask a neighbor. 9 times out of 10, there is someone around you who either knows the answer to the question or can refer you to the right place to go. At GuideWell, we have retail centers that are all across the state. Someone can walk in. You don't have to be a customer to walk in, and someone can help you and guide you. And it doesn't have to be that you select our plan. We're a community resource that will help you understand your choices. We're community-based. We operate here. We live here. We're very local, and we understand the needs of our community. We have these retail centers that are not just to sell insurance, but it's also to help people with lifestyle things, right? Helping people cook or internet, learning how to use the internet, exercise, social events. There are all these things that we try to provide to the community, whether you're our customer or not.
Camille Harrison, thank you so much for joining us here on the Health Channel. Such valuable information that you are sharing with our viewers. Again, thank you for being on with us.
Thank you. Thank you so much for having me.